Hello again everyone, this is Dr. Habib and welcome back to the channel. Today we will be discussing the Renin Angiotensin Aldosterone system. I hope you find this video of value, and if you have any comments or questions, please leave them below and I'll do my best to get back to you. So to understand the Renin Angiotensin Aldosterone pathway, it's quite important to see the reasons behind the secretion of renin. We have three broad categories: low blood pressure, low amounts of sodium detected by the nephrons, and an increase in sympathetic drive. Let's have a look at them in a bit more detail. So low blood pressure can be as a result of, say, dehydration, or blood loss. Dehydration or blood loss will lead to a low blood pressure, thereby stimulating the baroreceptors in the carotid sinus, and this will eventually cause release of renin into the blood. Low amounts of sodium in the blood is detected by a group of cells known as the macular denser cells, and these are present in the distal part of the loop of Henle of the nephron, and this, in combination with the juxtaglomerular cells, will cause an increase in renin production. Bear in mind that the macular denser and the juxtaglomerular cells together form what is known as the juxtaglomerular apparatus. Okay? And then looking at increased sympathetic response as happens in a flight or fight response. This response is mediated by, via beta-1 adrenergic receptors, okay? So now that we have renin in the blood, what are the next steps in this pathway? So the liver is going to secrete angiotensinogen, which is eventually converted to angiotensin 1, and this reaction is mediated by renin. It's going to lead to hydrolysis of angiotensinogen to angiotensin 1. And we have another enzyme called angiotensin converting enzyme, secreted by the lungs and also bound to the endothelium. That's going to help convert angiotensin 1 to angiotensin 2. And on the next slide, let's have a look at some of the functions of angiotensin 2, which are quite important. So what are some of the functions? Well, it serves as a very potent vasoconstrictor in the blood. It helps increase blood pressure, and it also helps maintain the glomerular filtration rate in the kidneys. It also serves to increase absorption of sodium. How does it do it? It does this by the sodium-hydrogen exchange channel in the proximal and thick ascending limb of the loop of Henle. Okay? So let me just write down the location of the sodium-hydrogen exchange channel. So this is going to be in the proximal convoluted tubule of the nephron, and also in the ascending loop of Henle. Another important function is secretion of aldosterone. This happens from the adrenal cortex, and within the cortex there is a region known as the zona glomerulosa. And what's the important function of aldosterone? Well, it helps to absorb more sodium, and it causes excretion of potassium in the urine. It does this by the sodium-potassium ATPase located in the distal convoluted tubule, which is sensitive to aldosterone. It also releases a hormone known as ADH, antidiuretic hormone. Another name for it is vasopressin. It's released from the posterior pituitary, and it causes absorption of water from the collecting ducts of the nephron via aquaporin channels. Another function of antidiuretic hormone is it serves as a vasopressor, causes vasoconstriction. Okay, so going back to the previous slide, let me just briefly talk about the mechanisms of two antihypertensive agents. One of them is an ACE inhibitor, such as ramipril. So this drug is going to block the action of angiotensin converting enzyme from converting angiotensin 1 to angiotensin 2. So this pathway in the RAS system is going to be blocked. So that's one antihypertensive. Another one is an angiotensin receptor blocker, ARBs. Example of this is losartan. Angiotensin receptor blockers act by blocking the action of angiotensin 2 on its receptors, which are present in the blood vessels, thereby preventing vasoconstriction and eventually lowering the blood pressure. It also serves to reduce the sodium absorbing effects of the RAS pathway. So that concludes today's talk. I hope you found value in this video. I'd like to thank you for watching, and if you could please hit the like button and subscribe to the channel, I'd be most grateful, and I hope to see you again soon in the next video. Bye bye.